Welcome back, everyone. Folks are enjoying this nice weather out there. Okay, well, if you have maybe a bad knee, a herniated disc, and you thought, well, you're just going to have to live with it, there are some new options for you. And joining us today is Dr. Wendy Askew with the Dr. Rogers Centers, and we're talking about stem cells again. And this is just, it almost sounds like science fiction when you talk about it.
It's really kind of the future of medicine that's actually come to practice today. So we're real excited about the therapies that we're offering.
So what are exactly stem cells?
Stem cells are kind of like our body's own natural repair mechanism, and they are a special type of cells that we have all throughout our body that possess certain abilities that other cells don't have. One is that they can make more of themselves, and then two is that they respond to injury or damage in our body, and they can turn into different tissue types.
So they're little, like, morphing things, like in science fiction almost. So you got a demonstration.
Yeah, I do. So, for example, if I go skiing and tear my ACL because I'm old and I shouldn't be skiing anyway, the stem cells in my body will recognize those injury signals from the knee, and they will differentiate. They'll migrate to the knee, and they'll turn into a tendon cell, or if that's what I've damaged to become. Now, say I've suffered a heart attack and I'm recovering, and as my body's recovering from that, the stem cells will recognize those signals, and they will migrate to the site where the heart attack occurred into a myocardial cell to repair the scarring and the injury that occurred in my heart. So they respond to what we need and then become that type of cell.
So the same cell, in this case, can either turn red or turn blue, whatever's needed.
Green, yellow, whatever tissue is involved.
Okay, and you get these from the person, not from an outside source or anything like that, which makes it easier. So who's a candidate and how does it work?
Yep. Patients with degenerative joint disease, so knees, backs, any joint injury, autoimmune conditions, lung conditions like COPD, difficult to treat neurodegenerative conditions like Alzheimer's, Parkinson's, MS, are all some of the conditions that are under our nationally approved IRB protocols for treatment. So we're following the patients real closely for outcomes and for safety.
And when you say the IRB protocol, this is not, it's one of those where it's still kind of in the experimental phase,
exactly,
so to speak.
These treatments are still considered investigational, and so that's why we're working with the IRB is so important to provide the patients a higher level of safety and monitoring, tracking all their outcomes so that we'll have more data so that hopefully these will be applicable to everybody and available to everybody and insurance covered.
And you get the stem cells from a good area, if you will, if you want to kind of trim up a little bit for summer. So
we're using fat. So most of us got plenty of fat to sacrifice and that can be used. So we do a mini liposuction, harvest 50 cc's of fat, process it very carefully, and then give an IV infusion of processed stem cells. And if you need it in a joint or a back, we inject it into the joints. We've got a pain management doctor who does it under fluoroscopy for the back patients. So they get both concentrated cells in the area and a larger number of cells in an IV.
So just the IV, and then they know where to go, and they all of a sudden seek it out and say, we need to go here and do this and become heart valve cells or something like that.
Like you said, little Morphin Power Rangers, they respond to the signal of distress or damage and go to that area and do their transformation into that type of cell.
Okay, well, if you'd like more information about this treatment, it's the Dr. Rogers Centers, and you can call 210-495-2117 or go to drrogerscenters.com. Dr. Askew, thank you very much.
Thanks so much for having me.